Hi, I'm Dr. Andrew Neviaser. I am a shoulder and elbow surgeon here at OrthoVirginia. I see patients in our Fairfax and Alexandria offices. And I'm going to talk to you today about some of the recent technological advances in shoulder replacements. We've been doing shoulder replacements for decades, but in the past 5 to 10 years, there's been some huge advances that make getting a shoulder replacement a much more predictable and precise operation. We use a computer to assist with the surgery so that we can install the parts of your shoulder in the perfect position so that they'll be supported for your bones. And we're hoping that this translates into the shoulder lasting you for a lifetime. Shoulder arthritis is less common than arthritis in the hips and knees, but it does happen, and when it does, it can be severely debilitating. It can cause you to be unable to even get dressed in the morning, brush your hair, or brush your teeth. And when it is severely debilitating, there aren't many treatments that are effective for it. You can try medicines, occasionally physical therapy, but for the most part, to get it cured, you need to get a shoulder replacement. We do that by replacing the ball in the socket in several different ways, and there are two general varieties of shoulder replacement. One that replaces the shoulder with a ball and socket in the native position, what we call an anatomic replacement, or one where we reverse the ball in the socket to compensate for other deficiencies in the shoulder, like rotator cuff deficiency, that allow your shoulder to work without having all the muscles and tendons that typically are present in the shoulder, but in these cases are not. Both of these are very, very successful, and each one is appropriate in different circumstances. I often get asked which one is better, and in fact, there is no correct answer to that. We use each one when it is appropriate to get the maximum function for your shoulder. The addition of computer navigation has allowed us to predictably support the metal and plastic parts with your own bone so that they are less likely to wear out over time. So when we decide we're going to proceed with the shoulder replacement, we get a CAT scan of your shoulder and make a three-dimensional model that we can actually perform a virtual surgery on through the computer. We do that about a week before your operation to size all the parts and tell us exactly how much change we need to make to the bone so that the shoulder will fit in perfectly. Then when we do the operation, that surgical plan and model is uploaded to a computer that's actually hooked to the operator table. And the instruments that I'm using, in a way, Bluetooth more or less to that computer. And as I use them, the computer is giving me live feedback so that we are executing the angles and steps exactly how we planned. And we can measure the accuracy down to 1 single degree. So when we're done, we have executed the plan exactly as we had intended, and it ensures that you get perfect positioning of all of the components. Perfect positioning, we expect, will lead to better durability, and ultimately, when you get your shoulder replaced, we expect that that will be the last time you ever have to have surgery on your shoulder.